Right. Ever pictured yourself right at the heart of like a super busy medical office?
Yeah.
Imagine you're juggling patient care, you've got administrative tasks, clinical procedures, and all while, keeping a smile on your face. Sounds exciting,
Yeah,
right?
it is.
Well, that's the life of a certified clinical medical assistant.
Yeah.
And today, we're diving deep into how you can become one. Big shout out to London Heartbeat's Z Academy for, well, sharing their expertise with us for this deep dive. Make sure you guys are following them on like Facebook, Instagram, Spotify, and YouTube. You don't want to miss out on their content. And they've got free regular updates.
So let's talk about the NHA CCMA exam.
Yes.
This is your golden ticket to becoming a certified clinical medical assistant. Whether you're already, wearing your scrubs or just curious about this whole healthcare world,
Right.
we're breaking down everything you need to know about this exam.
And what's fascinating is that healthcare is like this ever-growing field.
It is.
And certified medical assistants, they're in high demand.
Yeah. This certification can really open doors. It can boost your earning potential, too.
For sure.
And as we unpack the details of the exam itself, you'll see how it equips you with, the skills employers are looking for.
Definitely. Let's start with the basics. Who can actually take this exam? Is it just for, people who've been studying for years?
Not at all.
Okay.
Actually, the beauty of the CCMA exam is that it's flexible.
Okay.
You can take two paths.
Okay.
First, completing a medical assisting program that gives you, the structure, the hands-on experience. But what's great is you can also qualify just through work experience. If you've already got some practical skills,
Right.
You're good to go.
So even if you haven't been in, a classroom setting for a while, you still have a shot at becoming certified.
Exactly. It makes this profession open to a wider range of people. Of course, you need a high school diploma or equivalent no matter what.
That makes sense. So you checked all the eligibility boxes. You're ready to, dive in.
Yep.
How do you sign up for the exam?
The NHA website, it's actually super user-friendly.
Oh, good.
You create an account, fill out the application, pay the fee, and then just watch your inbox for the scheduling details.
Okay, so it's pretty straightforward.
Yeah.
But, I always like to get a head start.
Of course.
Would you recommend creating that NHA account early on? Even if someone's just thinking about maybe taking the exam?
Absolutely. Creating an account early lets you see what resources they have, get familiar with the platform. It's like a sneak peek before the big show.
Love it. Okay, enough about, the logistics.
Right.
Let's talk about the actual exam.
Yeah.
What should you expect when you walk into that testing center?
Get ready for 150 multiple choice questions.
Okay.
And you've got 3 hours to conquer them all. Now, that might sound like a lot of time.
Right.
But trust me, managing your time is key. It's a marathon, not a sprint.
3 hours for 150 questions.
Yep.
That's quick math.
Yeah.
A little over a minute per question.
Right.
Okay, can't spend too much time daydreaming.
Exactly. That's why practicing with timed mock exams is crucial.
Yeah.
It helps you get comfortable with that pacing and avoid that last-minute panic.
Definitely, definitely. All right, so we've got these 150 multiple choice questions, but what topics do they actually cover?
So the exam is divided into 5 key content areas. They're designed to, assess the essential skills of a clinical medical assistant.
Okay.
We're talking medical assisting procedures, patient care, pharmacology, anatomy and physiology, and then administrative and clinical procedures.
Hold on. Patient care. That's where my heart is.
Mm-hmm.
I bet that section, really speaks to anyone who's drawn to this career, to healthcare.
Oh, absolutely. It's all about understanding what patients need, communicating well, and providing compassionate care. But here's the thing. These content areas, they have different weights.
There?
So some sections count more toward your overall score?
Wait, so some questions are worth more than others?
Kinda, yeah. It's like different levels in a video game. That's why checking the detailed content outline on the NHA website is essential.
Right.
It tells you exactly how much each area contributes to your final score so you can plan your study time strategically.
That's a good strategy.
Yeah.
Tell me more about the questions themselves. Are there any, curveballs we should watch out for?
All the questions are multiple choice, but some might have visuals like diagrams or images.
Okay, to make things interesting.
Exactly. And here's a tip. Those all of the above or none of the above options, those can be tricky.
Oh, yes, those all of the
You
above.
just be careful with those.
They get me every time. But how does the scoring system work? Is there, a penalty if you guess?
No penalty for guessing at all.
Okay, good.
The CCMA exam uses something called a scaled scoring method. Think of it like adjusting a recipe based on what oven you're using.
Okay.
Your raw score, that's just the number you get right,
Right.
that gets converted into a scaled score. This considers how hard the exam is.
So there's no magic percentage you need to pass.
Exactly. The key is to answer every question, even if you have to guess.
All right, so no penalty for guessing. Phew.
Yeah.
Now, where does this exam magic actually happen?
The CCMA exam is usually taken at Pearson VUE testing centers. They're all over the country.
Okay.
But there's also remote proctoring.
Oh,
You can take the exam from home.
nice.
Make sure you have good internet and a quiet space, though. No pajamas allowed.
Remote proctoring. That's super convenient. But no matter where you take it, arriving early is always a good idea.
Oh, absolutely. Aim to be there like 15 minutes early so you have time for check-in.
Speaking of check-in, what does that involve?
Make sure you have your photo ID, your driver's license or passport, and your registration confirmation email. Also, check the rules of the specific testing center beforehand.
Good to know.
You can usually find that info on the Pearson VUE website.
Okay, so we've got eligibility, registration, exam format, scoring. I think we're ready for some test-taking strategies.
Let's do it.
What are your top tips for conquering this exam?
All right, first and foremost, read each question carefully. Don't rush. Make sure you get what they're asking. Then, try to eliminate any answers that are obviously wrong. It's like a detective game.
Love that analogy.
And of course, time management is key. Can't stress that enough.
Time management, the theme of the day.
Uh-huh. Yes.
How can someone stay calm and collected during the exam? Any tips?
Practice exams are your best friend. Think of them as dress rehearsals.
Okay.
The NHA website has some great ones. They'll get you familiar with the questions, reduce test day anxiety, and help you practice your pacing.
So practice exams are a must. But what about studying for the actual content? Where do you even begin to tackle all that information?
The official NHA CCMA exam study guide, that's your holy grail. It's like the ultimate cheat sheet.
Yeah.
It lines up perfectly with the exam content and gives you a solid foundation.
Sounds essential. Anything else that could help?
Use those practice exams to figure out your strengths and weaknesses. And think about joining a study group or taking a review course. You'll get that collaborative learning and some extra support.
Study groups are great. Bouncing ideas off others can be so helpful.
It really is.
Keeps you motivated too. What about mobile apps? Are those useful?
Mobile apps are fantastic for quick study sessions or reviewing on the go.
Right.
They're especially good for memorizing key terms. Perfect for those little bursts of study time you can squeeze in.
We've got the study guide, practice exams, maybe a study group or review course, and some mobile apps to round things out.
Sounds like a solid plan.
It does. What about the big day itself, exam day? Any guidelines we should know?
Remember what we talked about earlier? Arrive early. It's always better to be safe than sorry. And listen carefully to the proctor's instructions. Make sure all your belongings are stored away securely. No sneaking in cheat sheets.
Of course. Phones and cheat sheets are a no-go.
Absolutely.
Any other pro tips for exam day?
Here's what I learned. Dress comfortably. You don't want to be thinking about your clothes during the exam.
All right.
Bring a watch to keep track of time because you might not be able to use your phone. And pack a light snack for break time. You'll need the energy during that 3-hour exam.
Great advice. So you've taken the exam, you survived those 3 hours. How long until you know if you passed?
Good news. You get preliminary results immediately after finishing. No nail biting. The official score report comes via email within a few days, and if you pass, congratulations. You'll get instructions on how to get your certificate.
Getting those preliminary results right away must be a huge relief.
It is, but remember to check your spam folder. Important emails can end up there sometimes. You don't want to miss that celebratory email.
Good point. So let's say, hypothetically, someone doesn't pass on the first try. What then? Is it game over?
Not at all. It's totally normal to need a second try. You can retake the exam after 30 days. You get up to 3 attempts within a year. There's a fee for each retake, but don't let that stop you.
3 attempts. That's reassuring. What advice would you give someone who has to retake the exam?
Use it as a chance to reflect. Think about how you studied. Find those weak spots and maybe seek some extra help. The NHA website has tons of resources, and you can always ask experienced medical assistants for advice.
All right, so you pass the exam, celebrate, get your certificate. But what about staying certified? Is it a one-and-done thing?
Not quite. The CCMA certification is good for 2 years. To renew, you need continuing education credits, which basically means staying updated on the latest medical assisting practices.
That makes sense. Healthcare is always changing, so staying current is important.
Exactly. Lifelong learning is key in this profession. There are lots of ways to stay ahead of the curve: professional development, conferences, industry publications. It's about keeping those skills sharp.
Sounds like there's always something new to learn.
There is.
That's exciting. We've covered a lot today. Before we wrap up this part of our deep dive, are there any other resources you'd recommend for people who want to become medical assistants?
The NHA website is a fantastic resource. They've got everything: study materials, FAQs, contact info for support. Online forums and groups are great too for connecting with other medical assistants and people preparing for the exam.
Yeah, for support.
Exactly. Sharing experiences and getting tips can really help. And of course, those mobile apps are great for studying on the go and keeping up with industry news.
That's a great list of resources.
Yeah.
Now, before we send our listeners off to conquer this CCMA exam,
Right.
let's talk about some common pitfalls to avoid. What are the biggest mistakes people make?
One of the biggest is not reviewing all the content areas. Remember, anything on the exam is fair game.
Right, right.
Poor time management during the exam is another one. Practice pacing yourself so you don't rush at the end. And last but not least, make sure you know the exam format really well. The more comfortable you are with the structure and questions, the less anxiety you'll have on exam day.
Excellent points to remember. Now, let's zoom out a bit. Why is getting certified so important in the first place? What's the big deal?
Certification is more than just a piece of paper. It shows your dedication to the medical assisting profession. It means you've met industry standards and you're committed to great patient care.
So it's like a way to stand out and show employers that you're serious about this career.
Exactly. It's like a badge of honor. Certification can boost your chances of getting a job, getting a higher salary, and advancing in your career.
Those are some pretty good reasons to get certified, but is there anything beyond those, like, professional benefits?
Absolutely. It's personally fulfilling, too. It validates your skills, shows you take pride in your work, and you know you're making a difference.
It's not just about getting a job. It's about a career you're passionate about, something where you can have a positive impact.
Exactly. And as a certified clinical medical assistant, you're a vital part of the healthcare system. You're supporting doctors, caring for patients, and making healthcare more efficient and compassionate.
Sounds incredibly rewarding.
Yeah.
Okay, everyone, we've officially decoded the first part of the NHA CCMA exam journey. We covered everything from, who can take the exam, to test-taking strategies, the content, and even common mistakes to avoid. Huge thanks to London Heartbeat C Academy for their amazing insights. Don't forget to subscribe to their social media: Facebook, Instagram, Spotify, and YouTube. They're a fantastic resource for anyone entering this exciting world of healthcare.
Definitely.
As we move on to the next part of our deep dive, think about this. How can becoming a certified medical assistant give you the power to make a positive difference in patients' lives and contribute to the whole healthcare field?
That's a great question.
All right, listeners, thanks for joining us so far. We're going to continue this deep dive and explore even more about the CCMA exam. Stay tuned.
Can't wait. Welcome back to our deep dive into the NHA CCMA exam. Let's zoom in on those 5 core content areas we mentioned, starting with medical assisting procedures.
Okay, I'm ready. What exactly is in that section? What kind of skills are we talking about?
This section tests your knowledge of the essential clinical skills, the backbone of being a medical assistant.
Okay, the hands-on stuff.
Exactly.
Right.
Imagine taking patient histories, recording vital signs, helping with examinations, and even minor surgical procedures.
Oh, wow, okay.
It also covers things like sterilizing instruments and following infection control practices, keeping things safe and clean.
Right, crucial stuff. So it's really about those practical skills, the stuff a medical assistant needs to know to work in a clinical setting.
Exactly, yeah. It's where your clinical skills are really put to the test.
Got it. Let's move on to patient care. What does that involve?
Patient care focuses on, how well you can interact with patients and provide compassionate care.
Okay.
It goes beyond just taking vitals. It's about really understanding their needs, educating them about their health, and of course, maintaining confidentiality. Building that trust is key.
I bet this section is super important for anyone who's drawn to this career, anyone who really wants to work directly with patients.
Absolutely. It's about combining strong communication, empathy, and creating a positive experience for every patient.
Makes sense. Next up is pharmacology. Now, I'm not a medical expert or anything,
Sure.
but I know this is about medications, right?
You got it. This section is all about the basics of pharmacology, the different types of meds, how they're administered, calculating dosages, and even potential side effects.
Okay, so medical assistants need to be pretty knowledgeable about medications.
Definitely. They might even administer meds under a physician's supervision.
Wow.
So a strong foundation in pharmacology is crucial for safety and delivering good care.
Got it. On to anatomy and physiology. This one takes me back to high school bio, dissecting frogs and all that.
Well, no frogs on this exam, thankfully,
Good.
but you do need to understand the human body, its systems, and how it all works.
So, like knowing the organs, the systems, the processes.
Exactly. Think anatomical terms, the different organ systems, and all those fascinating physiological processes. It's like the language of healthcare.
Okay, that makes sense. And lastly, we have administrative and clinical procedures. That sounds like a bit of a mix. What's covered there?
This section is all about the administrative side of things. Think scheduling appointments, managing medical records, processing insurance claims, and basically keeping the office running smoothly and efficiently.
So it's about being organized, good with tech, but still focused on patient care.
You nailed it. Medical assistants wear many hats, and this section highlights the need for both clinical and administrative skills.
I can picture myself walking into the testing center, feeling all confident and prepared from all that studying. What happens then?
First things first, you check in, you show your ID, your registration confirmation, and the proctor will help you through it.
Okay,
They're there to answer questions and make sure everything goes smoothly.
got it. And then showtime. Any last-minute advice for test takers?
Just breathe, relax, and trust all the hard work you put in. You've got this. Pace yourself, read carefully, and don't be scared to make educated guesses if you're not sure about something.
Great advice. Now let's jump ahead to the big reveal. How do you get your results and ultimately that certification?
Remember, you get preliminary results right after you finish the exam.
It's good, no waiting.
Right. The official score report will be in your email inbox within a few days. If you pass, celebrate. You'll also get info on how to get your certificate. That's proof of all your dedication and hard work.
Awesome. But I imagine some people might feel bummed if they don't pass on their first try. What advice do you have for them?
It's important to remember that it's okay to not get it perfect the first time.
Everyone makes mistakes.
Exactly. Don't give up. You can retake the exam after 30 days, and you have 3 tries within a year. Use this as a chance to review your study stuff, see where you need to brush up, and maybe get some extra help. Keep at it.
That's encouraging.
Yeah.
Now let's talk about the bigger picture of the career itself. Why is being a certified medical assistant such a good career choice, especially these days?
The healthcare field is always growing, always changing, and skilled medical assistants.
In demand.
Very much so. It's a stable career path with great job security, something that's pretty valuable these days.
For sure. What about salary? What can certified medical assistants expect?
Salaries can vary based on where you live, your experience, things like that.
Of course.
But on average, it's a competitive wage. And with experience, maybe some extra certifications, you can definitely move up and increase your earning potential.
So a good starting point with room to grow.
Mhm.
What about the day-to-day work? What's it like to be a certified medical assistant?
One of the best things about this job is that every day is different.
Keeps things interesting.
Right. You're interacting with patients, helping doctors with all sorts of procedures, and handling administrative tasks to keep things running smoothly. It's fast-paced, you're constantly learning, and you're really making a difference.
Sounds like a great fit for someone who likes variety and who really wants to help people.
Absolutely. You're a vital part of the healthcare team supporting patients and physicians. It's challenging, but really rewarding.
Okay, so we've looked at the exam, the career path, and the benefits. What's your top piece of advice for someone considering this path, wanting to become a certified medical assistant?
Go for it. It's a rewarding career with great job prospects and the chance to make a real difference. Start by checking out medical assisting programs or figuring out how to get some work experience. Then focus on prepping for the NHA CCMA exam using all those awesome resources we talked about.
Yeah, the resources.
And don't forget, connect with other medical assistants and embrace that lifelong learning.
Great advice. Speaking of resources, listeners, don't forget about the London Heartbeats Z Academy. They're fantastic for anyone interested in becoming a medical assistant.
They offer great training programs, guidance from experts, and a supportive community to help you succeed.
Definitely. Check them out on Facebook, Instagram, Spotify, and YouTube for all the info.
Now let's get even more specific. Let's look at some examples of what you might see on the CCMA exam, for each of those 5 content areas.
Love it. Let's get into it.
Starting with medical assisting procedures. Imagine a patient walks in, they think they have strep throat.
Okay, I'm putting on my medical assistant hat. What do we do?
First, you'd want to greet them, make them feel comfortable. Then you'd take their vitals, temperature, pulse, respiration, blood pressure, and you'd ask about their symptoms, get their medical history.
So collecting all the info before the doctor sees them.
Exactly. You're like a detective gathering clues for the doctor. Once you have that initial info, you'd prep the patient for the exam. That could involve things like a throat swab.
And this is where knowing about sterilization is so important, right?
Absolutely. Infection control is critical. Certified medical assistants know how to sterilize things properly, keeping everyone safe.
Okay, let's switch gears to patient care. Can you give an example of how a certified medical assistant would use those skills, those patient care skills?
Sure. Let's say a patient is anxious about a procedure.
Oh, that's common.
It is. A good medical assistant would pick up on those signs of anxiety and offer support. They'd explain the procedure clearly, answer questions, and just make sure the patient feels comfortable and cared for.
It's about going beyond the clinical stuff, really connecting with the person.
Exactly. Building that trust is at the heart of good patient care.
Let's move on to pharmacology. Can you give us an example of something a certified medical assistant might do related to medication?
Under a doctor's supervision, a certified medical assistant might give a vaccine to a patient.
Okay.
That means picking the right vaccine, prepping the injection site, giving the shot using the right technique, and then documenting it all.
Sounds like a lot of responsibility.
It is. And that's why knowing pharmacology is crucial. They play a big role in giving medication, so they need to be confident in their knowledge and skills to keep patients safe.
All right, on to anatomy and physiology. How might this be tested on the exam? Give us a real-world example.
You might get a question about how a certain organ system works, like the respiratory system. You'd need to know the main organs involved, like the lungs and trachea, and how they all work together to let us breathe.
It's like understanding how the body works as a whole, like a big puzzle.
Exactly. This knowledge helps medical assistants talk to doctors, understand what's going on with patients, and give the right care.
Okay, last but not least, administrative and clinical procedures. What's an example of a typical administrative task a certified medical assistant might do?
Scheduling appointments is a big one.
Okay.
They need to know how to use the scheduling software, manage patient records, and coordinate everything to keep the office running smoothly.
So it's all about organization and multitasking.
Definitely. Good administrative skills are key for efficiency and a positive experience for everyone in the office.
This has been so insightful. We've really dug deep into those 5 areas of the CCMA exam.
We have.
And it's given us a clearer idea of what it takes to be a successful medical assistant.
It's been great sharing this info with you and our listeners. Remember, becoming a certified medical assistant can be challenging, but it's so rewarding. With hard work, preparation, and the right resources, you can achieve your goals and start this amazing career in healthcare.
And speaking of resources, listeners, the London Heartbeat Z Academy is fantastic for anyone wanting to become a medical assistant.
They offer great training programs, guidance from experts, and a supportive community to help you thrive. Be sure to check them out online and on social media.
Yes, find them on Facebook, Instagram, Spotify, and YouTube. You won't regret it. Now, before we wrap up this part of our deep dive, let's talk about some of the challenges and rewards that come with being a certified medical assistant. We want to give everyone a realistic picture, all right? Yeah, let's be real. No job is perfect. What are some of the, tougher parts of being a certified medical assistant?
You're right. Every job has its challenges. And medical assisting, it can be demanding, both physically and emotionally.
Yeah.
You're on your feet a lot, dealing with all sorts of patients and personalities. Sometimes you might face situations that are, stressful, maybe even sad.
So it's not all sunshine and rainbows. You need to be pretty resilient, have a real passion for helping people.
Exactly. But for people who love healthcare, those rewards, they really outweigh the challenges. Knowing you're making a difference, helping people feel better, supporting them through tough times, that's powerful stuff. It's not just checking things off a list. You're actually contributing to people's well-being and helping the whole healthcare system run smoothly.
That's got to be motivating. Let's talk career advancement. What are some paths for certified medical assistants who want to, grow and expand their skills?
That's the great thing about this career. There's no one set path. With experience and maybe some more certifications, you can specialize in areas that interest you. Pediatrics, cardiology, ophthalmology. So many options.
Wow, that's a lot.
You can also move into like supervisory roles, taking on more responsibility, leading a team. And if you want to go even further with education, you could become a registered nurse or a physician assistant.
So it's definitely not a dead-end job. Lots of room to grow, specialize, even go in totally new directions within healthcare.
Exactly. What you learn as a certified medical assistant, it's like the foundation for so many possibilities in healthcare. It's a great stepping stone to a really fulfilling career.
I love that. Before we wrap up this whole deep dive,
Right?
let's circle back to the importance of the NHA CCMA exam.
Yes.
Why is this certification so important for people who are serious about this career path?
Think of the NHA CCMA certification as like a seal of approval. It tells employers you've not only met the standards, but you've gone above and beyond.
Okay.
It shows you're skilled in a lot of different areas. It proves you're dedicated to doing your best and giving patients the best care possible.
So it's how you stand out, show you're a pro, and that you're passionate about healthcare.
Exactly. It really helps with getting a job, getting a better salary, and building a successful career.
This deep dive has been amazing. We went from the details of the NHA CCMA exam to what it's like to be a medical assistant and all the possibilities that come with it. I want to say a huge thank you to the London Heartbeat Z Academy for giving us all this incredible content. Their commitment to education and passion for healthcare is so inspiring.
I totally agree. The London Heartbeat C Academy is a fantastic resource for future medical assistants. They really go above and beyond to help people succeed in this field.
And listeners, don't forget to check out London Heartbeat Z Academy on social media, Facebook, Instagram, Spotify, and YouTube. They have tons of info, resources, and support that can be super helpful. Plus, they have free updates, so you won't miss out on interesting discussions like this one.
Definitely check them out.
To wrap things up, I want to leave you with this thought. Healthcare is always changing, which means there are always new challenges and opportunities. Keep learning, stay curious, and never stop trying to be the best you can be. Your dedication to getting better, it won't just help your career, it'll make a real difference for your patients.
That's so true.
Thanks for joining us on this deep dive into the world of medical assisting. We hope you feel informed, excited, and ready to take that next step toward a fulfilling career in healthcare. Until next time, keep learning, stay curious, and we'll see you on our next deep dive.